When I see a child succeed at something, I can't have any greater joy. It's written all over their face, all over their body. They like to talk about it. It doesn't matter what it is, but they're happy. They're social beings. Kids are just fun. They're special. The goal of rehabilitation is to start with a patient, no matter where they are, and get them to their highest level of function. We also want to make it fun, because to get a child to come back for therapy, they have to enjoy what they're doing. They have to see progress in what they're doing. So we know how to do that. We make it fun, but we make it work at the same time. Outpatient rehabilitation at Shriners Hospital consists of physical therapy, occupational therapy, and speech therapy services. We see a wide range of disabilities. We might see babies who have developmental problems, children with neuromuscular disabilities. We see amputees, patients who might have ankle sprains, who might have knee pain, all the way up to athletes who need sport-specific rehabilitation. We have scheduled team meetings to talk about what the progress of that patient is, what their needs are, and what specialty areas should work with that person. In rehabilitation, a physical therapist will look at the overall functioning of a person. So they could be looking at the way the person's walking or the way they're moving throughout their environment. An occupational therapist will look at how the child is progressing in their occupation. So the occupation of a child is playing, going to school, writing, taking care of themselves. In speech pathology, we look at the way a person can communicate. We have patients who are verbal and might just need articulation assistance, or we have patients all the way who are nonverbal and might need communication devices. We have the Motion Analysis Center, where we can look at the way somebody is moving and really hone in on what their deficits are and work to strengthen those areas of their body. We have everything that you would think would be in a gym, and then we have real state-of-the-art equipment. The Rheoambulator is a robotic device where a patient doesn't even have to be able to bear weight on their legs, and it's programmed to put their legs through a walking sequence. It looks like they're walking in air. From there, we can take them and use our zero-G, and with that equipment, we can control the force of gravity on that person. And we can program that system, so if the person is going to fall, they might fall at 20% of gravity, or they might fall 18 inches and then the device will catch them. We have an Ultra-G, which is a treadmill, and it fills with air. So the device will take up to 80% of your body weight off while you're on a treadmill. So if they're coming back from an injury and they might not want to put their full body weight on their legs, we can still program their muscles and work with their muscles to get up to the strength that they need to function at their highest level.